Hello, this is Sudharshan, and in this episode PH 1.19 part 2, we will talk about drugs for bipolar disorder. And the drug of choice here is lithium or lithium carbonate. So let us see the mechanism of action. It is poorly understood, but it is known to inhibit the recycling of the IP3 and DAG, that is inositol triphosphate and diazyl glycerol, back to phosphatidyl inositol. So what happens here in the mechanism of action? So we have the phosphatidyl inositol phosphate that becomes PIP2, then it becomes PIP3, and then it divides into IP3 and DAG, and it recycles back to the PIP. So that step is inhibited by lithium. Yes, and apart from that, it reduces the release of the catecholamines like norepinephrine and dopamine. Yes, that is the mechanism of action. Uses: apart from mania, it can treat to an extent epilepsy, prophylaxis of migraine. These are some of the uses. And with respect to the side effects, let us see. So side effects: it causes GI distress, CNS depression. Then in the kidney, it causes diabetic nephropathy. In the CVS, it leads to heart block. And also, it increases the WBC count. It's poorly understood why it happens. And it inhibits the release of thyroid hormones. Yes. And with respect to the pharmacokinetics, this drug, lithium carbonate, has a lower therapeutic index. So this drug has to be used with careful monitoring. And also it has liability to cause the diabetic nephropathy. So patients with kidney failure have to be administered the drug with caution. And also, very importantly, it is contraindicated in pregnancy. It causes a condition called Epstein's anomaly, where there is dislocation of the leaflets of the tricuspid valve. Yes, and with the drug interactions, it interacts with drugs like thiazide diuretics, neuromuscular blockers, and haloperidol. So, thank you so much. We'll see in the next lesson.